unfortunate, and apologies for that, but it seems to solve the audio and video problems a lot of the time. Okay, so I was actually going to do a Mentimeter, but I think that's probably redundant with the number of people that might be in the room. So I was just wanted to do a quick series of introductions between ourselves in the room. And so for those of you who don't know, I'm Venkat, much longer name, but Venkat for short. I work for the Digital Curation Centre, University of Edinburgh, so I'm based in Edinburgh. And I am one of the co-chairs for this group. Originally, I'm a biologist, and now I've got into this working group with the topic at hand. I have my other co-chairs here, Celia and Anu. There is actually one other co-chair who can't be with us. He's in Australia, so unfortunately he can't make it. But I ask Celia and Anu to introduce yourselves as well, please.
Celia, go ahead.
Okay, thank you. Hello, good morning, good night. I'm Celia. I'm a health engineer at the Virgen del Rocío University Hospital as part of the Andalusian Health Service in Spain. I have 5 years of experience as teacher in medical informatics project at regional and international level. And currently, I'm member of the coordination team of the Fair for whose main goal is to provide a community to apply the FAIR principles, share and reuse the health research data sets. Also, I'm a researcher in a new European project that is Healthy Cloud. That is a project that has just started in March.
Yeah, so I guess it's my turn now. Hi, my name is Anupama Gururaj, and I go by Anu, and I am at the National Institutes of Health, NIH, and my institute is the National Institute of Allergy and Infectious Diseases. That's in the US, and my background is primarily as a cancer researcher, and I kind of morphed into an informatics researcher, primarily clinical informatics, and yeah, that's about it. But right now, I actually oversee a repository as well as handle management of informatics grants.
Thanks, guys. Yeah, I invite anyone else that's in the room to unmute and put your video on, and just please introduce yourselves. Thank you.
Sure. I'll go ahead and jump in. My name is Anthony Juni. My background is in medical informatics, epidemiology, and a lot of work leveraging the electronic health record. Also, supporting implementation and adoption of a number of different outputs and recommendations. Now moving on to the NIH, supporting a HEAL project surrounding sharing of medical research and clinical research and outpatient research surrounding opioid overdose and new clinical treatments for opioids. So helping to support researchers and sharing their data into an ecosystem there and seeing how to best support the reuse of that data. So.
Okay, great. Yeah, anyone else? I see some other people have joined us actually, just literally in the last few moments. Yeah, if anyone else wants to introduce themselves in the room. No? But in the chat window, you can see a link to the shared document as well. And if you want, at least put your name and your affiliation there, please, if you'd like to be, yeah.
Real quick, sorry, I think maybe the shared notes that you're sharing, I don't have access to them. I think maybe they're not on editing privileges for sharing, that you have to request access. Just
I'm sorry. Thank you for pointing that out.
No, you're fine. Sorry. Thank you.
Well, thank you for letting me know. Let me just quickly do that. I do apologize.
That's fine. Actually, that's I just see the chat window. Frankie Stevens said that video and sound is challenging. And so he just wanted to introduce himself, I guess, over chat. And, folks could do that too. Frankie, could you just type in a little bit about your background and your interest in the HRPO working group?
Okay, I've changed the permissions. Hopefully everyone can edit in there. Do let me know if nothing's changed. But yes, yeah, look, if no one else is going to join us again or introduce themselves on screen, that's fine. So welcome again, and I wish people could actually have visited Edinburgh and seen this beautiful city, and amazingly the weather was so nice at the moment, but yes, unfortunately we're doing this virtually. So I'm just going to quickly do a bit of housekeeping. I did a bit of an introduction about the interface. Sorry to those who joined us late there. I should also remind people that the session is being recorded. So if you don't want to be recorded, then yes, please do keep your cameras off. The shared document, which we've just discussed, that has a link to these slides. I was going to do a Mentimeter, but I think it's probably unnecessary if there's not too many people in the room. I just wanted to essentially get an idea of where people were coming in from, but I think I've got a pretty good idea anyway. Right. So this is an agenda of what we were going to cover today. So yeah, an introduction and objectives of this meeting, which we've kind of done, but a background to this working group, where this all started from and where we are now. And the main part of this particular meeting is really about the landscape doc, which you should have read about through some emails that we sent in the last few weeks. So I'll give you an update of that. We'll then have a video from our colleague Alicia from the Fair for Health project about the fairness for HL7 fire group, which actually Anu is also involved with. And then we'll have some time for a general discussion and also the next steps that we intend to take. And really, this is obviously meant to be a collaborative thing. So if you do have any comments, then I invite you to speak up and of course use the chat window and the Q&A function as well. Yeah, just to quickly reiterate here, introduction and objectives of this meeting. So present what's been done and then gather feedback on it. And we wanted to identify expertise, whether or not it's you or people that you may know that can verify and review what's been written in this landscape document and what still needs to be done. We're hoping that it can be finalized in the next 1 month or so. That's our hope anyway. And at this meeting, we also want to provide background to the Fairness for Fire group, as I mentioned, and also identify potential targets for collaboration, whether that's external groups or other groups within the RDA. We've already done that, but maybe we've missed some things that you guys might be able to point us towards. But yeah, whether or not it's within the RDA or externally. Okay, so looking at the background and previous results, this working group really originated back in RDA Plenary 13. And back then, it was actually just a birds of a feather group. So it was an informal gathering just to gauge the interest in the topic at hand. And it originated from this Fair for Health project as well, which Celia and myself are part of. That project is an EC-funded project, and it's primarily focused on the European context and building a technical platform for allowing better reuse of health research data and applying the FAIR principles to it as well. So we're not just talking about the technical platform, but also looking at the policy landscape as well. But as I say, that's only looking at the European context. So the point of this working group was to try and expand that into the more global arena. So yeah, just saying here, building on work done by that Fair for Health project and the policy landscape document that was created from that for Europe, the ambition was to extend this to the global context. The Fair for Health project aims to verify, share, and reuse their data sets derived from publicly funded research initiatives through the demonstration of the potential impact that such a strategy will have on health outcomes and health and social care research. So the idea is that local rules and regulations, wherever that might be, whether that's within Europe or in the wider global arena, as I say, may hinder the advancement of data sharing of sensitive data across borders, and specifically FAIR data. So how to overcome this? Well, hopefully we can come up with a common set of guidelines that can be adopted at the global level. So subsequent to those birds of a feather meetings, because there was actually more than one, we decided to try and make this more formal and make it into a working group. And so we wrote a case statement, which you can read at the link highlighted here on this slide. And we got endorsement for the group late last summer. And the first proper meeting of this working group was actually at the last plenary meeting back in November. So we have about a year left of this working group to deliver these outputs. So the previous results on this particular slide are the 5 main draft guidelines that were proposed by this document that was created by the Fair for Health project and the landscape document that was created from that. And I have to stress this is draft guidelines. I'm not going to go into them blow by blow here. I welcome you to read them at your leisure. But the point is, we want to build on what's written here to see whether we can actually apply this to the more global stage. We're not saying that they're correct. We're not saying that they're the best way of doing things. We just want to know whether these could at least be adapted or maybe just altogether rejected even. We don't know, but we want to see what happens. So I'll just take you through what we've done so far, essentially since the start of this year, and that's this landscape document. So if you look at the case statement, there are a series of milestones that we projected to do, and tasks rather. And the first thing to do was this landscape document to get an idea of what the different policies are, if there are any, of course, in different regions around the world. And use this as the starting point to try and do analyses of what restrictions there are, how to overcome these things. And so, yeah, this is just meant to be an overview of what's going on in the world, and it's a snapshot, of course, of what's happening right now. We've done all the work so far, the co-chairs, that is, and we welcome input from here on in. This statement in the second bullet point is actually taken from the case statement. So what we wrote at the time was review of the current landscape for fair adoption of health research data, taking into consideration levels of privacy and ethical considerations granted to such data in regions around the world. This will be based on existing and recently completed work done by Fair for Health in the EU context and the EOSC landscaping work currently being carried out. That should have actually been in the past tense because that's been done. So as I mentioned previously, there is some landscaping work that was done in the Fair for Health project as well, and that's been incorporated somewhat into this landscape document as well. There are many gaps that need to be addressed, specifically in Africa, Latin America, and Asia. We've tried to find as many policies and documents as possible, but of course, we don't have enough knowledge in these areas. And this is where we're hoping that this working group, the people that are attending the call now, and any other contacts that you may have, might be able to help us out, to point us in the right direction of resources that we haven't picked up on. You know, there's only so much you can do with Google searching. And there might be a lot of things that are just not available to us. We have done an extensive literature review, and it was quite fortuitous that in January of last year, in 2020, there was a special edition in the journal Data Intelligence all about FAIR. And there was a series of articles in there that were actually very pertinent to what we're trying to do here. And so a lot of the information and the references that we used actually came from there. If you haven't seen this issue, then please do look it up. Data Intelligence, January 2020. So we have used local and other contacts where possible, as I said, but again, maybe we don't have enough from just the co-chairs ourselves. The document is open for review by the working group and any other interested parties, so please forward the link to it to anyone else that you might know that may be able to look at it. So a couple of random questions here are is what has been written thus far factually correct? And do you know of any missing policies and references, as I mentioned before? So I welcome everyone to have a look, and please do comment. It is open for comments. And as I said, we're hoping to finalize it in about a month. The next step after doing the landscaping is, if you look at the case statement, the next task that we outlined was to actually do a analysis. We haven't started writing that yet, but that will be done quite soon. But I thought I would just give you some headline sort of findings that I just came up with off the top of my head, just looking at the landscape document as it is. And that's the Through Go Fair, which hopefully you guys know about. It's an organization originally set up in Europe, but now it has offices in various other regions around the world. And it's trying to advance the FAIR principles by actually having local offices and trying to create what they call implementation networks, or INs, as I've abbreviated here. And fortuitously, a lot of these implementation networks are actually based around health data. And so we were able to get a lot of information from there, which, yeah, is somewhat reflected in the landscape document so far. There are a lot of other intercontinental health-related projects that also bring together countries from low and middle income countries, including in Africa, Asia, and Latin America. And I was impressed to see that FAIR is mentioned in a lot of these projects. One such project I can mention is called CINECA, CINECA, which is basically bringing together expertise from Canada, Europe, and a whole load of African countries. And yeah, they specifically mentioned FAIR, and I was impressed that this is actually being mentioned explicitly. And so when we're thinking about trying to create a unified guidelines, this certainly helps if these things are already being explicitly being mentioned. However, I also found that there were not many national level policies and funder related policies, even in high income countries. And so that is a cause for concern, perhaps. And perhaps one of the most interesting and important things to take into consideration is cultural sensitivities and differences. And that these need to be addressed when we're thinking about trying to come up with these unifying guidelines that could be adopted around the world. What applies in high-income countries and Western nations might not always be easily accepted in African or Asian countries, etc., because yeah, there's a lot of distrust or other factors at play. And of course, the care principles are something that hopefully you've heard of, and there's been talks on it at this RDA plenary. Maybe these are the kind of things that need to be brought in as well. Okay, that's actually all that I'm going to speak about, but I'm not going to, has there been any questions or anything? No, no, not that I can see. But we're going to have some time later on as an open discussion forum. But now I'm going to actually move on to the next part of the agenda, which is a guest speaker, Alicia Martinez, who represents both Fair for Health and also this Fairness for HL7 Fire group. She's going to provide a talk, which is a pre-recorded talk, and she'll provide a brief intro to herself, but this is some bio for her as well. As I said, she is a colleague of Celia's mainly, but also a colleague to me through Fair for Health. So what I'm going to do is I am now going to stop sharing the screen and switch to a video of her talk. Okay. Okay. I hope the audio works. Do tell me if it's not working.
Hello, my name is Alicia Martinez Garcia. I am PhD in software engineering applied to health informatics standards. Before starting, I would like to thank to the chairs of this working group to give me the opportunity to share with you this related initiative. I'm going to tell you the main aspects and the next steps for the Fairness for FIRE Health Level 7 projects and the FIRE for FAIR Health Level 7 FIRE Implementation Guide. Firstly, I'm going to introduce the initial context in what we started working in this parallel initiative. This context is the Fair for Health European project. This European project started on December 2018. It's coordinated by the Andalusian Health Service of Spain, from Spain. And in this consortium has 17 partners from 11 countries. The main objective of these European projects is to facilitate and encourage the European Union health research community to verify, share, and reuse the health datasets. To perform this, we are covering 4 specific objectives. The first one is to develop a outreach strategy at European Union level. The second one is regarding develop a fair data certification roadmap. The third one is to design and develop a technological platform. And the fourth one is for validate this platform to perform 2 case studies to demonstrate the potential impact that this solution has in a health context. Summarizing, the objective of this project is to verify the health data. Here you are, the social network of this European project. In the case you would like to have more information of Fair for Health projects. This is the technological solution that we have defined and we propose in Fair for Health projects. To traduce the raw data in fair data, we defined a verification workflow, and to technically develop this verification workflow, we propose it to use Health Level 7 FIRE standard. So in this context, we identify the need to work in a Health Level 7 project to formally define how work with FAIR principles using the Health Level 7 FIRE standard. The goals of these Fairness for FIRE projects is to facilitate the collaboration between the FAIR and the FIRE communities, to enable a cooperative usage of the FIRE and FAIR paradigms, and to support the health data fairness assessment by using Health Level 7 FIRE conformance resources. The first expected result that we are going to have in this working group is to develop a FIRE implementation guide called FIRE for FAIR implementation guide that is under development. The scope of this implementation guide aims to provide guidance on how Health Level 7 FIRE can be used for supporting fair health data implementation and assessments. We started working in this parallel research line in August 2019 in a workshop in Medinfo conference. In this first workshop, we discussed the topic, and we defined a first draft of the objective of the working group. We continue working in this line in 2020 in 2 workshops in MIE and EU China conference. In these two workshops, we continue defining the proposal, and we disseminate, we share our concerns to identify more participants to work with us in this working group. And last year, we sent the first proposal of the projects to Health Level 7 Technical Scientific Committee, and we obtained the formal approval in November 2020. We worked in the 26th Fire Connectathon in January 2021, proposing a specific fair track. And since February 2021, we started with weekly follow-up meetings. In this working group, we have 4 participants from the Fair for Health partners, Health Level 7 Europe, the Andalusian Health Service, the Institute for Medical Informatics, Statistics and Epidemiology from the University of Leipzig, and the HRDC company. And by other hand, we have 2 participants external of the Fair for Health consortium. For example, we have involved people from LDA, from Computable Publishing, from NIH, Pistolia Alliance, The Hive, Mitre, Sambit Solution, etc. And what is our future planification? We continue performing weekly meetings. Normally, these follow-up meetings are on Wednesdays in the afternoon in CEST time. And next month, in May, we are going to participate in the 27th Fire Connectathon. In this case, as we don't have at this moment a first stable version of our implementation guide, we have proposed to work in specific fair education sessions in other tracks in the Connectathon to continue sharing our proposal and to try to disseminate the FAIR principles and to try to catch more participants in our project, in our Health Level 7 projects. In May too, we are going to work in a workshop in MIE conference. We sent a proposal and we are waiting the formal acceptance, but I'm sure that we will work in this sense. And in September 2021, in the context of the 28th Fire Connectathon, we will work in a specific fair track to test the implementation guide. And in October 2021, we would like to propose a workshop for Medinfo conference and to work in this research line. Our plan is to formally present the implementation guide in the Health Level 7 September ballots. For this, we must to have a first draft of the implementation guide in June, and we must to have the final context for our implementation guide in August. This is our planification. And with this diagram, I would like to share with you what is the methodology that we are carrying out in the working session to advance the implementation guide. Firstly, we started collecting real-world scenarios involving a collection of health data. Until now, we have defined 4 scenarios. The first one regarding healthcare data. In this scenario, Fair for Health project is participating because in Fair for Health project we are working with health data. The second scenario is regarding citation and publication. The third scenario is regarding research studies and clinical trials. And the fourth scenario is regarding terminology. We are open to work in other scenario if any participant propose and think that is interesting. The idea of working in different scenarios is to cover with the implementation guides different kind of health data and not only healthcare data to have a more complete guide. When we have defined a specific scenario, we started describing how the scenario could be implemented with FAIR standard in line with the FAIR principles. Then we formalize the FAIR conformance resources needed to cover this scenario. And finally, we check how the first metrics and indicators apply to this FAIR-based implementation scenario. The situation of the implementation guide is that we are in the fourth scenarios. We are formally defining the different scenario, and we have started describing the first step, how could be implemented with FAIR and FAIR principles. And in one specific example of citation, we have started checking how the FAIR indicators apply to this scenario. To cover the last step regarding the FAIR indicators, we are using the FAIR indicators proposed by the RDA FAIR Data Maturity Working Group. In this link, you could access to the complete publication. This initiative proposed a list of 41 definition to cover the FAIR principles, and the idea of our working group is to analyze one by one if our proposal solution using FAIR standard cover or not these characteristics. And I would like to take the opportunity of this event to invite you to join us, to join these HLSM projects and this working group. Here you are, the website of the HLSM projects. And I would like to tell you that we are using different communication channels. We are using a chat in Zulip. Here you are the specific link. You could follow the first stream in Zulip to discuss with us. And we are using a mailing list. Here you are the mailing list. You would like to work with us and to be add to this mailing list, please you could mail me in this email address, and I could manage it. And in this mailing list, we send all the follow-up weekly meeting. That's all. I'm sure that this related initiative could be very interesting for your working RDA working group. I'm sure that we could find relation and collaboration between the two related initiatives. If if the audience has any concern or has any doubt, please you could email me in this email address. And that's all from my side. Thank you very much for your attention.
Great. And thank you to Alicia for recording that for us. So she was with us in person on Tuesday, but as I said, too late in the night on this occasion for her. And we'll be sharing that video with you if you want to watch that again. And likewise, as you know, this session is being recorded as well. Sorry, let me just share the screen again. Great. And I should have said also that, well, actually, I realized while we were watching that presentation that I haven't actually given you the link to the landscape document anywhere.
So, Venkat, I did put a link to the landscape document in the chat previously.
Oh, you did, sorry.
Yeah,
Okay.
yeah. And also in the shared note, in the collaboration notes, you do have a link to the landscape document.
I'm sorry, I actually missed that. Yeah, okay. But the reason it was just reminding me was that if anyone wants to read a bit about the what Alicia was just talking about, it's actually mentioned in the landscape document as well, and there are links there to various things about the project. Okay, so the idea was to now just actually have a discussion, and this is where we wanted input from you, everyone in the audience, that what we've described so far with what we've done with the landscape document, and also with what Alicia was talking about, and just open the floor to discussion. We want to hear what, if you've had a chance to read the landscape document already, then that's great. But of course, if you've not, then we still have time. I mentioned that maybe in about a month's time that we're wanting to finalize it. There's no hard and fast dates that we've set in our heads. But yes, we're hoping in about a month. But if you've managed to have a quick skim of it even, and you have any thoughts, we know that it's just a draft and there is a lot to be filled in. I mentioned a few of the biggest holes in the analysis, the landscaping regions in Asia and Africa, for instance. And so, yes, we welcome your thoughts. Maria?
Hey, my name is Maria Schatz. I work for NIHS, National Institute of Environmental Health Science, part of NIH. So I didn't have a chance to skim the landscape document, and I'm really confused. So as I see it, there are two main barriers for data verification for health data. One is protocols and methods of exchange like FAIR, so lack of thereof, and lack of uniformity in metadata. This is number one. Another is rather policy barriers, right? So each country has different policy on how you can expose and exchange your health data, and I have my own opinion on why is it bad, but nevertheless. So which problem are you trying to solve in this group?
So to just sum up what you asked there, one is technical and one is policy, correct?
Yes.
So I would argue that the first point that you're making, we can actually set aside, because the FAIR principles, the way that they were originally developed, they're not specifically telling people to use any given technology. That's not what they're about. And that's not what we should be thinking about here either. Here, I would agree that we're trying to iron out any differences between different regions about policy. And yes, this might only be achievable at a very high level. I realize that. I mean, we can't go too deep into it because that's just never going to happen, I think, to find commonalities across different countries or continents, whatever. So, but we are really just looking at policy differences here.
So I'd like to add something to that, Maria. The idea is essentially to kind of get a sense of how many policies around the world actually touch upon the FAIR principles at all, if they do, and then see if we can come up with a minimal recommendation or guidelines of things that could be implemented or you know, to see some implementations of these like minimal guidelines that you need to have, at least to initiate a certain extent of verification of the data. And one aspect, I know when everybody says health research data, everybody's thinking about, you know, only clinical data and predominantly you know, thinking of clinical trials or even, you know, data coming out of electronic health records. But as you probably appreciate, there are a lot of studies that are done which could be called health research, right? Even if they're like very basic science research, they still belong to the health space because they're addressing a specific health issue. And so such studies also fall into the purview, and it's probably a little easier to handle than some of the other kinds of data that we typically talk about when we talk about health data. Does that help?
Can you give me an example of what are you talking specifically?
In terms of other kinds of data, epidemiological data, that's still health data, but it's not necessarily has all the same constraints that you have when you're talking about clinical data. Data that's generated, let's say, by preclinical data that's generated on a specific disease area, that is also health data, even if it doesn't, you know, fall under the same category as you have for clinical research.
But also all this, the wealth of, there's so much data being generated by fitness trackers, things like that. In the present day, they could also be very valuable as well, correct?
Yes, but I don't think you can access this data and use it for research without having an IRB.
Oh no! Look, I agree with. Yeah, of course. But let's say that you do have that permission.
So the point is not that it has to be open data.
Yeah.
Right?
No. What I'm saying is, to me, sensors data, trackers data is no different really from your blood pressure or lipid levels in blood, right? It's not very different. It also, I don't know whether it's not necessarily identifiable data, but it's still personal health data, and it's all governed by IRB. Now, when you go to epidemiology data, that's usually not, well, I don't know, it depends on the study, but once there is no IRB, there is no policy about it, you know. So if it's basic data, there is no policy, basic science data. It's not
in
covered.
terms of data sharing, you still have policies in place, right? I might do, for example, let me just take an example of what I have done in my an informatics. we decided to look at Twitter data, which is openly available, and to look at suicide ideation that is reported in tweets. This does not fall under any IRB purview, so it's considered exempt. Even if you do it through an IRB, it's considered exempt. But you still, after you do your research, then you still have to share your data, whatever you have done after you publish, typically, right? So when you want to share your data, then you still need to verify the data. And so then it's still is subject to policies, even within NIH, for example, or NSF. It still is subject to all of the policies that you have for data sharing. May not be as stringent as you have for clinical research, because there you have privacy issues, but you still have policies that govern it.
Oh, but those are the same policies that apply to any scientific data.
Correct.
I guess I'm trying to discriminate here. Here's the health data. To me, is something that governed by health IRB type of policies. All the rest of the data is basic science data. It should be shared, right? But it's not under health-related policies. It should be shared because it was funded by government grants, let's say. NIH requires you to share data which was produced using taxpayers' money.
Right.
But I'm just trying to understand the focus of this group, because to me the difference of IRB, so it's not only IRB, it's IRB and data use agreement. So you can have two studies that are parts of the same parent study, but they're kind of sub-studies, okay? And so the data use will be different for each of them, and then you can combine them because there is difference in access permissions.
You can or you can't?
You cannot. Well, it depends. It depends. Since every time you have a different data use agreement, you don't know. So you need to go and check each specific data use agreement, each IRB. And this is, to me, this is a huge problem.
May I say something? I think I follow what you're saying there, Maria, and I completely accept what the reservations that you may have. And yes, we're not talking about completely making data open, as was just mentioned a few moments ago. But remember, it should be possible to make the metadata open, and that will aid in the discoverability of any data that might be hidden behind some kind of firewall because of its sensitive nature. So if we can at least allow the metadata to be made fair and discoverable, then at least that leads to the data in question that's associated with that metadata to be found. And then, yes, you might have to go through separate checks and balances like access control and what have you to actually gain that data. But that is a separate matter. But at least you're making the data discoverable in some shape or form.
I think you actually got me exactly in an opposite direction. I'm all for sharing this data and for making this discoverable. I'm just saying the root problem to me is lack of uniformity in data use agreement and in IRB. There should be much more in common, that you don't need to be a lawyer to understand what you can use and what you can't. Like we had a data set and that we nothing special, just human sequencing data sets, and we wanted to present it on the internal website, just metadata, just for people to be able to discover it, right? So people don't. There is always hesitancy. Can I say that the age? Can I show the age of my participant in this on the as part of metadata? Can I display this? Can I display that? it should be so clear what is allowed, what is not allowed, and it should be uniform across the studies. As much as possible. Like, I know there are some sensitive populations, small populations like tribal, indigenous, then they're small. So if you show too much, it's really easy to go back to a specific person. But for regular large studies, should be much more uniformity, in my opinion. And you don't need to break your head and think what is allowed and what is not. Should be easier.
I agree partially because honestly, the repository that I oversee, which is called Import, we share clinical trial data. So we share participant level clinical trial data within Import. And this has no access controls. It's all, it is de-identified data. And as long as you register with Import, you can go in and download. There are probably about 145 or 150 clinical trials data there, and they are all downloadable. But that's not typical. And to be fair, it takes a lot of effort to get to that space where you can ensure that you have de-identified everything, and then you're able to share it.
Yeah, as we've heard in a few times through the course of this conference, yeah, how happy are you with the de-identification of these subjects as well?
Right. This is all structured data. There's no textual data coming from any of these studies that are shared. So, you can be fairly confident. If you have things like text, images, etc., then the complications, are piled on.
Okay. But I do share your concerns there, Maria. Yeah, and yeah, the IRBs, that's beyond the scope of what we're trying to achieve here. But yeah, that does sit alongside, I think, what we're trying to do in terms of trying to gain, provide some uniformity across different regions in the world. Yes, if we can provide some uniformity across the IRBs, then that would actually aid in the verification process as well. Okay. Sorry, any other comments in the room? Or if you have any other comments, Maria? Oh, Anthony. Oh, your audio.
I'm sorry. Yeah, I certainly don't want to interrupt Maria, so I don't want to steer the conversation away. So if I'm not interrupting, I do have two questions that are relatively. Okay. So to Anu's point earlier, there's a lot of work to be done at that sort of like interagency synthesis of policy as well as regional synthesis of policy, just to see where the gaps in protections are, the gaps in rights access, et cetera, and to provide that level of like guidance to people to how to meet those policies. But also there's a lot of work to be done at that typing level, so different data types and governance of different data types. So a lot of the document currently seems to be focusing mostly at that regional level and then going into maybe some of that interagency level. Is that still the plan, or will, to the previous discussion, are you going to go into maybe some of the typing issues of how is genomic data captured and protected, and what are the lessons learned from like the Cancer Commons to the work that you're doing in Import to a number of these different more kind of use-specific repositories where that data is deposited and harmonized? There's a lot to be learned on the type factor, but those are also kind of like specific agency policies as well. So that's the first question. And then the next one is kind of the operationalizing question of how do you take those policies and make them operational. So I'll move to that question because I think that's where the Fair for Fire work really meets that necessity and fills that gap. So I guess in summary, the quick question is just, is it mostly at the regional and interagency, or is it going even deeper to those lessons learned from the type issues?
So maybe I can take a shot at it initially, and then Venkat and Celia can add stuff in. So to my mind, at least for this working group, it's predominant of the regional and maybe interagency to a certain extent. But as you have seen from our landscaping document, we have gaps even in the regional space, right? There are areas that we have had no information about and would like to get information about. So I think it's too far to start talking about data types and how different types of data could or verification of different types of data can be achieved. And I think that's a little bit maybe too much in the weeds for this working group. I don't know if Venkat and Celia have something to say.
I completely agree. That would be far too much work for what we can achieve. But what we're really trying to do at the end of the day is trying to look for anything. I mean, okay, the obvious one would be GDPR here. Something, you know, that's all encompassing, that anything below that has to comply with the GDPR, right? I'm not saying that that's going to be possible everywhere in the world, but it's that kind of thing that we're looking for. The most high level policy that everyone has to comply with.
I think
that'd be the ideal scenario here. It's not always going to be there, but that is, where we can only go with within the scope of what we can do with the manpower that we have in this project.
So in terms of,
I was just wondering as well about what you're saying about data types. Do you really think that that there would be really a need to think about individual data types, that they're not interchangeable in a way? The policy for one would be more or less applicable to another?
No.
No?
I think the concern that
that's your answer right there.
Okay. We won't go in the weeds there. No,
Okay,
I think the concern I would have is the research community and the people that are actually trying to operationalize and meet that policy. They'll have different understandings of their data, how they are used to sharing their data. They have a completely different vocabulary, like all their vocabularies and ontologies would be different. Learning how to synthesize and harmonize that data against a particular policy, that I think would be the main struggle that you'd have there, is you may have a different community practice, but then also, yes, different protections for the data itself, either within the agency and also within the risk for re-identification and the risks that are presented to the patient and participant in the study when they share that data. So as much as I would hope for an ideal world where you can have one policy to rule them all, I'm concerned that that would be achievable. But what this working group allows is to at least synthesize policies, see where the top tier policy is and then where the gaps are across them. And then you hit the operationalizing factor of, okay, how do you leverage the fair data maturity model and metadata standards and other standards like FHIR to actually take this policy and build some sort of technical guidance for researchers to share their data and meet those policies, because there's a lack of compliance and there's a lack of enforcement, and then there's a lack of capacity for researchers to meet those policies. How do you provide some tools for them to do so? And that, I think, so that's kind of going to the second question, but that was the short answer to the first question. Then
Okay, Celia, do you have any thoughts on that?
No, really, I agree with you, Anu, in the comment.
Okay, great. We have a comment in the chat window. Bethania, compliance with general data protection laws requires technology. infrastructure and specialized personnel to ensure that personal data are processed in a lawful, fair, and responsible manner. Sorry, and then carries on, that are highly dependent on regional, economic, and social conditions. Yeah, sure.
Yeah, absolutely agree with that. However, I think a lot of from our review so far, we have seen that while most countries will provide general protections, a lot of them don't talk about data sharing or even fair data sharing. I mean, forget about fair data sharing. I don't think there's a lot of talk about data sharing or open science yet. So that's a big gap.
Okay. So we have 20 minutes left, or just under 20 minutes, but we've got maybe another 10 minutes of any other comments that you have about what we've done so far. I'm glad that, yeah, that some of the comments, they've been very useful and different to what we heard on Tuesday as well, actually.
Yeah. Also, just to, I'm just putting a link to the document again. Please do enter in your names and let us know if you are interested in joining the conversation within the working group. We plan to have a monthly meeting. We haven't started scheduling yet. That's the next on the agenda, right?
But we're going to do that immediately after. We'll try and start scheduling for next week.
Yeah.
Or rather, send out a doodle.
Yes.
But yes, soon thereafter.
So yeah, I think that's, sorry about that. That's my dog. So we would love to talk through some of the issues that you have all raised and incorporate that as part of this working group efforts.
So just to provide a bit more conversation here, and on the agenda, I said I would talk about next steps. And so the next steps, if you look at the case statement, is to do an impact assessment and an analysis of where we are through this landscape document. And these statements are actually pulled straight from the case statement. So assessing the impact of such restrictions in terms of research, as well as financial and societal impacts, drawing on previously mentioned work by Fair for Health and EOSC and others, and also this analysis of national and international guidelines and policies and their enforcement to compare and contrast and provide a foundation for the working group's own recommendations. So yeah, I gave you a sort of a couple of things that I thought off the top of my head, but there's going to be a lot more that we need to do and put down in writing as well. I was actually wondering about people's thoughts on what I particularly picked up on earlier on about cultural sensitivities and misunderstandings there may be that we need to overcome in low and middle income countries. We're heavily focusing on North America and Europe and Australia, but we really need to try and bring in these other areas like Africa. And yeah, it's well documented about mistrust, etc. And do people have any particular thoughts on how this should be tackled? Okay.
So yeah, there's an Indigenous Data Sovereignty group that has a lot of experts and a lot of expertise surrounding the CARE principles and work there. And then also I think I'm glad you all are even making sure that that issue is represented in your work. So.
Yeah, no, I know about this group, and indeed, I was actually present at their meeting earlier, although I didn't really participate. I was moderating, but yes, it immediately occurred to me that we should be trying to bring them regarding their expertise here, and the care principles, of course, as you mentioned too. But yeah, I just wonder whether anyone had any other thoughts on this, but thank you.
So also to touch upon, Maria was talking about, sensitive data, right? There is a new interest group that's coming up that that's kind of, coalesced around sensitive data, not necessarily just in medical or biomedical area. They're also talking about sensitive data. They were talking about, personal lands. I mean, things that we could even, at least I don't think of when I think about sensitive data. So that's another group I think that we should be interfacing with as well, because they probably are going to deal with a lot of the same issues and concerns that we will come in, contact with.
Okay, great. And actually, Maria just put a link in the chat window to.
I wish I could tell you more about this talk, but 1 week passed, and not too many details are retained in my head. But there were
there's a we will have. So I was part of the organizing committee for this talk at NIAID, and so we will have some. I think recordings will be made available, and I can definitely send it out to the whole group as soon as that's available. But that's really relevant. Thanks for bringing that up, Maria. And the other thing I did want to talk about, which was actually very interesting, and I think we had somebody from the legal group, right? Like somebody from a lawyer or somebody was there in our previous presentation.
Yeah.
So in here too, they were talking about how open science could sometimes hurt the people from whom the data is derived, like the data providers in a way, the participants in a study that's probably conducted. So they were talking about infectious. So they were very interesting perspectives. I can definitely provide a link to that. Thanks for bringing that up.
I actually, my last week was packed with. Sorry, is there an echo?
Yeah, slightly, but please carry on.
Okay, so my last week was crazy packed with all kinds of unusual talks, and I attended the guest. It was, I think it's NIH, NASA geospatial techniques for environmental human health workshop conference. There were topics that addressed exactly what you just mentioned. So that people, if you collect you collect data from the vulnerable population, right? So that's poor population, and you collect data about air pollution or all kinds of contaminants in that area. So it's not a personal data. So it's not protected. It's open data because it's about contaminants, right? But if you make it public, the value of their houses will go down, and they can't sell their houses. So how do you juggle that? Because on the other, you want transparency to a buyer. You don't want to drag someone to buy a house without knowing that the level of contaminants are high. Protect the seller versus the buyer here. You just replace one victim with another. So just
okay.
Yeah.
Is there anything else regarding that? The only other thing that I was going to bring up was, and it's more a case of we've not got around to it, but we do need to do community surveys as well. And well, indeed, the Fair for Health project did some community surveys, and we could likely reformat some of those surveys for our purposes. And I'm sure indeed there are other surveys that could be reformatted or remodeled for our own use. But we do need to engage with the community further and produce some qualitative analyses with these. So yes, that's something that's going to be done soon as well. Okay, so we've got just a few minutes left, and I don't have actually anything else left in my slide, but if there's anything else, any outstanding items that people want to mention, then this is the time for it. Sorry, Maria, what's this link that you provided?
So this is another community that are talking a lot about mobilized biomedical knowledge. I don't remember what it stands exactly for.
Mobilizing computable biomedical knowledge.
Yeah. So it's a lot about. I was involved in the first conference, and then I kept in touch with one of the groups, but not very much in depth. I believe they did a lot of surveys and information gathering on the same topics. So I was just thinking you might want, if you are not familiar with this group, you might want to review a little bit the activity and see whether you can glimpse something and say work.
So just to bring you up to speed, Maria, Brian Alper, who is a very large part of this group, is also involved in the Fair for Fire or Fire for Fair. So it's a small world. So yeah, so this group's input, I believe, is going to be there definitely.
Oh, so sorry, he's in Michigan. I've never probably spoken to him, but okay.
Yeah, and he actually has the citation use case that's being worked on in the Fire for Fair implementation guide is a use case that he brought up.
Okay.
So some of the work that they are doing, I think he belongs to, what is it called, computable publishings or something of that sort. So some of the work they're doing as part of this is getting incorporated into the Fire for Fair as well.
Okay.
All right.
Thank you. Okay. Well, sounds like there's no more comments, and well, if that's the case, I'm going to wrap up here. Thank you so much for joining us, and I'm really glad that you could in this repeat session. We've managed to catch some people from other time zones. I thank Anu and Celia for joining me, well, for me at this ungodly hour. And well, I hope you all enjoyed the conference, and I think there's a couple of more sessions to go in a few hours' time. Indeed, Anthony was saying he's got all night to go, but yeah, enjoy the rest. And it's a shame that you couldn't be in Edinburgh, but hopefully catch you in person soon enough. So thank you again, and good night from Edinburgh. And yeah, see you around. And we'll be in touch, of course, with if you put your name in the shared document, we'll be in touch. Thank you.
Yeah.